as we just heard the other day, so parts of QOF have been suspended until April. But chatting to the rest of the team, I think we're just going to crack on. You know, we're still way behind. We've got a lot of catching up to do, and if we drop the ball now, I think we're going to be in trouble. So what we're going to do is carry out some bits. We might just drop back on, but you know, there's still so many patients who have such great needs that we haven't identified yet. There's a lot of case finding to do as well. You know, we need to make sure that we're doing our health checks for seriously mentally ill. Our learning difficulties patients have had a shocker for the last 2 years. We need to make sure that they've got access to the care that they've needed, because you know, their health has not improved. You know, particularly alcohol services as well. Yeah, diabetes care. We're going to just carry on, really. And because also we've got this new team, this new multidisciplinary team, we've changed a huge amount of the processes, our recalls, the structures, who's involved with each of the disease pathways. And I think if we stop now, we're not going to be able to embed that. And also the team needs to find out what can they do, what skills can they bring, how do we work together. So we really need to keep going.
Brilliant, thank you, Liz. So David, I'm just going to come to you. Obviously you're leading a PCN at the other end of the country. Does what Liz say there resonate with you? Is there anything that you'd add on top of that?
Yeah, absolutely. We had a board meeting on Wednesday afternoon. There must be about 16 people on the board, something like that. Obviously, in decisions like this, what I say has no bearing. It was the clinicians and the practice managers, and you know, we've got a practice nurse like Liz who's on the board. They were unanimous to absolutely follow everything that Liz said, and even to the extent you could see different camps agreeing. So some people were driven by clinical altruism, the kind of things that Liz talked about, but also others driven by we've got to keep the coding going. We've got to keep the accuracy. We've got to keep the records. It's a good discipline to keep to QOF. These systems will come back in.